Hi, welcome to my channel. My name is Janice and I have a chronic illness called multiple sclerosis. I have quite a few other issues to deal with as well, but MS is the one that is probably considered the most serious of everything. I was diagnosed back in 2011 and my particular journey was a little bit different than for a lot of people who are diagnosed because they often have serious events happen and then they spend months, even years, trying to find a diagnosis, trying to find out what happened, why all these things are happening, and then they're expecting that they're going to get some kind of treatment that's going to help make it much more manageable or maybe even better. In my case, I had very, very light symptoms. I had some numbness and tingling. I had a thing called Lermite sign, which is when you tilt your head forward, you get kind of a zap down your back. And honestly, when I went to the doctor, the feelings I was having seemed very simple and not that big a deal, maybe a pinched nerve. But my family doctor did suspect something more. He didn't say anything, but he said, well, let's get you an MRI via a neurologist just to see what's going on, just to rule a few things out. And then even the neurologist who I saw over the course of the next year, even when she saw some lesions on my MRI, said, oh, well, it could be this or this or this. It could be MS, but I don't think so. Don't worry about that. So I actually didn't even look into it. And then, more than a year after my initial appointment, I went back in thinking I was going to be told, oh, it's no big deal. Yeah, it's fine. Don't worry about it. And instead, she kind of fumbled around and eventually said, yeah, you have MS. And then she fired me off to the MS clinic, and that's the last I saw of her. Now, another thing that is a little bit different for me is the first doctor that I saw at the MS clinic had a long respected career as an MS neurologist. We don't have many of those around here. Usually you just see a regular neurologist who doesn't know a whole lot other than to just prescribe the medications and that's it. This particular doctor was near the end of his career, sadly, but he'd had a wonderful long career and he had used the medications, the usual standard drugs that all neurologists are strongly suggested to use, and we call those disease-modifying drugs, or DMDs for short, or sometimes disease-modifying treatment, or DMT. This doctor had spent so much time over his career giving this stuff to his patients and then seeing that they had a ton of side effects and they weren't really doing anything more than for patients who couldn't tolerate or chose not to have the medications. And so by the time he saw me and he saw that my symptoms were much lighter, my lesions were fewer and they weren't huge, he decided that I really should not be on any medication. That's a neurologist telling me not to be on medication. And let me tell you, I was very happy to hear that because I know I've been through other issues with the medical system where I have been damaged by medications that were prescribed and recommended for me. So to hear him say there are other ways that you can do this was great. He didn't have any options as far as diet, nutrition, lifestyle changes, and really nothing like that because that wasn't his specialty. But it was really encouraging to hear an actual specialist who really understood the disease as best you can in the medical system telling me not to take the meds. Now, of course, eventually he retired. He was an older guy and it was time for him to retire. And I have since seen a couple of other neurologists who were not specialists in MS. They just kind of help out with the MS clinic. And both of them, the only thing that they know to do is prescribe the medications. And so that's all they do is they constantly push and push and push to get me on the medications. I'm still trusting that first guy though. And of course, I've done my research. I do my research. It's been over 10 years now. And everything that I see is that there are a ton of side effects that you have to live with. So your quality of life is already decreased by just having this illness. Because for me, even though a lot of the initial issues have gone away and I've found ways to treat them, which I'll maybe talk about in another video, there are things that I have that are probably permanent. I've had chronic fatigue for actually most of my life, which was just undiagnosed. And I'd like to make a video about that too, because there's a lot that I have to say about living with chronic fatigue. I have hyperacusis, I have heat intolerance, I have a number of other issues that just compromise the quality of my life, and I have to live with them. They're not going to go away. They are not treatable with any disease-modifying drug, which I have been told by the neurologist. So I have to live with that. And then when I have to look at taking other medications, I have to weigh how many more side effects I want with what the might be possible outcome of a positive improvement or something, or just maybe less declining in the future. That's really what they're mostly hoping for the DMDs. So do I want to have all those other side effects? Because these medications don't just have a risk of side effects, they have side effects. They're known to have side effects. And some of them in the stronger, newer medications can actually give you cancer. They can kill you. They can really cause a lot of problems. They can destroy your liver. Even some of the lighter ones can wreck your liver. So I really don't love the idea of putting that into my body. It's just not something I'm too excited about. So I have to then say, okay, if that's the case, then what will I do with the symptoms that I'm having, the relapses that I may have from time to time, and how am I going to deal with them? Because ultimately, if I don't take those medications, neurologists don't want anything to do with me. They have nothing else that they can offer. They don't deal with nutrition, lifestyle changes, maybe a little bit, get a little bit of exercise, do some weights, that kind of thing. But otherwise, they don't know anything about the different kinds of nutrition that you can use to help improve things. Now, they're not a cure. There is no cure. They don't even know what causes MS. And my theory is that MS is probably an umbrella term for a variety of different conditions that are caused by a variety of different things. They just don't know very much. So while I do appreciate the medical system for a lot of things, especially emergency care, that kind of thing, when it comes to chronic illness, and MS is not the only one, treatments are limited and often more harmful than helpful. So this is my journey through all of that. And I'm kind of on my own to figure it out. I have to do my own research because I'm on disability. I don't have a lot of money to spend on a functional medicine doctor, or I've tried some naturopaths. I haven't really had any success and have blown a lot of money trying things that really didn't help me any better than the medical system was trying to. So I have to research. That involves talking to a lot of other people with MS. What have you done? What meds have you taken? What haven't you taken? What kinds of nutrition are you using? What are the dangers of certain kinds of nutrition? Because there are downfalls for some of that too. You can't just take anything because it's natural. That doesn't mean it's necessarily good for you. You could be allergic to it still, or you could have a weird effect, or it could interact with something else. So it's very complicated, and I don't have any kind of medical training. So it's you feel kind of like you're blind and just trying to grope your way through and figure it out for you, because we're all different too. They call MS a snowflake disease, like many others, that everybody presents differently. We'll have some same symptoms that we can talk about, but ultimately there's nobody else out there with MS who has exactly my symptoms or exactly my journey. So I want to talk about that a lot more. I want to deal with the medical system. I want to deal with nutrition and alternate therapies, and maybe some of the more controversial therapies, and especially things like patient advocacy, because we have to advocate for ourselves in the medical system. We can't really live without the medical system. We do need it for some things. I want to get into more issues specifically related to my most recent event that happened and left me questioning and alone and absolutely falling through the cracks of the medical system. I had an event that was either syncope or seizure. Some of you can relate to that. Nobody knows which it is. So here we are. And I spent months not getting any real treatment. The ER did not really do a very good job of dealing with it. They sent me for no scans, no EEG. They just discovered in my file that I had MS and said, well, that's probably all it is, and sent me home. And I was left with no answers. And I have the one event that I've had, which was in the summer, so that was almost 4 months ago now, was exactly all the symptoms of either a seizure or syncope. There's just no way of knowing. I've had EEGs, they don't show anything. I've had Holter monitors, they don't show anything. There are no tilt table tests here, so we can't find out if it's VVS or not. That's called vasovagal syncope, which has to do with your heart rate, heart rhythm, blood pressure, those kinds of things, as opposed to having neurological activity that causes a seizure. So here we are. And of course, my current neurologist, who is new and young, and she's new to me, and she ran an MRI, which good for her, because we want to make sure it wasn't a tumor or something like that. But the only thing she could say is, yes, you have new lesions, and so probably that's what caused this seizure, and now she's saying it's a seizure. Therefore, here, take these really super expensive medications that she will get a really fancy kickback for. And that's the only option she has. She also wants me on high-dose steroids way after the fact, and I have not had any other events. And she wants me on epileptic medication as well, just in case it was a seizure. We don't know if it was, but she wants me on that for at least a year. And then if I have no seizures during that time, then I can come off of it and go back to not being allowed to drive for at least another 6 months. And of course, for now, for the foreseeable future, I'm not allowed to drive anymore. No, I didn't drive much anyway because of my fatigue, so I'm very cautious about not getting out there on the road when I don't feel up to it. But now I have no option. I have lots of medical appointments to try and get myself to without a car. So do you think anybody in the medical system actually cares about that? I don't think they do. You know, I'm not saying that all doctors or nurses are bad, but I just don't think that there's much opportunity to care about patients as patients, especially when most of your appointments are on the phone or your face is all covered up so they can't even see who you are. There's a lot of frustration, and that's just the latest thing. You know, the medical system has been a problem long before the last couple of years, and it's only getting worse. So where do we go from here? Let's talk about that. I'd really like to discuss this with other people who are battling these things, even if it's not MS. If you're dealing with, you know, lupus or fibromyalgia or any number of other issues that you're struggling with, or maybe you just got symptoms and you don't have a diagnosis yet. Diagnosis is just one step in the journey. So hang in there and do your own research and do what you can, and let's all talk about it. You know, I'd love it if we can help each other find some different ways to deal with these issues. Thank you for watching, and please do subscribe to my channel. I'm hoping to do lots more videos all about these subjects.